Do you sometimes feel like you're wobbling when you walk, even if you're not dizzy? Or does your child often trip over their own feet while running? Maybe their eyes sometimes look like they're moving without control. These could be signs that something is going on with the body's balance system. One rare condition that causes this kind of issue is Ataxia-Telangiectasia, or a T. It's not just about clumsiness. It's a serious health problem that affects movement, the immune system, and even how the body fights illness. Imagine trying to ride a bike with no training wheels, but your brain keeps forgetting how to balance. That's how hard daily movement can be for someone with a T. So what causes a T? It all starts with a mistake in the body's instruction manual, your DNA. Think of DNA like a cookbook your body uses to make everything work right. In a T, there's a typo in the ATM gene, a very important recipe. Both parents must carry this broken recipe and pass it on for a child to get the disease. It's like needing two faulty copies of the same page in the cookbook for the dish to go wrong. This gene mistake makes it hard for the body to fix damaged cells and control movement, which leads to the symptoms we see. Now let's talk about what happens in the body. The first sign most people notice is trouble with balance and coordination, called ataxia. For example, a toddler might walk late and wobble a lot, not just a little clumsy, but clearly struggling. Over time, their hand movements get shaky, making it hard to hold a spoon or write. Another key sign, tiny red spider veins around the eyes or ears. Those are telangiectasias. You might notice them after a bath or on a sunny day. Kids with a T also get sick, often lots of colds, ear infections, or pneumonia, because their immune system is weak. Some also have high levels of a protein called AFP in blood tests, which is a clue doctors look for. First, they watch how the person walks, talks, and moves. Then they check medical history. Has this been getting worse over time? Next, blood tests can show if the immune system is weak or if AFP levels are high. A genetics test confirms it by finding the faulty ATM gene, like spotting the typo in the cookbook. Though there's no cure yet, treatment helps manage life. Physical therapy strengthens muscles, speech therapy helps with talking, and special medicines can reduce infections. For example, if a child keeps getting pneumonia, doctors may give immune-boosting treatments. It's all about helping the person stay as healthy and active as possible. Can we prevent a T? Right now, we can't change the genes a child is born with, so we can't prevent the disease from happening. But if you're planning a family, and you know a T runs in your family, genetic testing can help. Think of it like checking the cookbook for typos before passing it to the next cook. Couples can meet with a genetic counselor, a special doctor who helps explain the risks. If both parents carry the faulty gene, there's a 1 in 4 chance each child will have a T. Knowing this ahead of time helps families make informed choices. Good news, scientists are working hard on a T. Recent research is testing new drugs that help cells work better even with the broken ATM gene. Some drugs being studied act like emergency helpers that take over the job of the missing protein. Gene therapy is another exciting area. Imagine fixing the typo in the DNA cookbook so the body can follow the right recipe. Early trials in labs and animals look promising. Also, better physical therapy tools, like balance games using VR headsets, are being tested to help kids improve coordination in fun ways. While a full cure isn't here yet, each discovery brings hope for a better life for those with a T.